Today's our topic is Puerperium. So what is Puerperium? Puerperium is the period following childbirth during which the body tissue, especially the pelvic organ, revert back approximately to the pre-pregnant state, both anatomically and physiologically. So it's begun as soon as placenta is expelled and last for approximately 6 weeks, 42 days. 3 stages there: immediate, early, and remote. Immediate within the 24 hours, early stage up to 7 days, and remote stage up to 6 weeks. Then involution of the uterus. So what is involution? Involution is means genital organ is returning back to the normal position. So at delivery, uterus size is 20 into 12 into 7.5 centimeter and weight is approximately 1000 grams, means 1 kg is weight. But after involution, reverted to non-pregnant size of approximately 60 grams. Lower uterine segment isthmus in a few weeks. The contour of cervix regain in 6 weeks. External os never revert back to the nulliparous state. Even uterus also not revert back to the nulliparous status. So this is the diagram showing serial section showing uterus 5 days after delivery. The physiological process of involution is most marked in the body of the uterus. Changes occur in following components: muscles, blood vessel, and endometrium. Muscles. During puerperium, the number of muscle fibers is not decreased, but there is substantial reduction of the myometrial cell size. Blood vessel. The change of the blood vessel are pronounced at the placental side. The arteries are constricted by contraction of its wall and thickening of the intima followed by the thrombosis. During the first week, arteries undergo thrombosis, hyalinization, and fibrinoid and arthritis. When and obliterated by thrombosis, hyalinization of the endophlebitis. New blood vessels grow inside the thrombi. Endometrium. Endometrium regeneration starts by 7th day. It occurs from the epithelium of the uterine glands, mouth, and interglandular stromal cells. Regeneration of the epithelium is completed by the 10th day and entire endometrium is restored by the 16th day, except at the placental site where it takes about 6 weeks of time. Clinical assessment of involution of the uterus. Fundus lies 13.5 centimeter above symphysis pubis for the first 24 hours of the delivery. Then decrease by 0.5 inches in next 24 hours. Day 14, it's become a pelvic organ and per abdomen is not palpable. Completion is by 6 weeks. So within the 6 weeks, uterus become a normal size, and with the day 14, uterus is become a pelvic organ again. So see the size of the uterus, how it is decreased day by day. Vaginal discharge for the first fortnight during lochia. Lochia is a vaginal discharge for the first fortnight during puerperium. Odor, offensive, fishy smell, color and composition. 3 types of lochia is there: lochia rubra, lochia serosa, and lochia alba. Lochia rubra is 1 to 4 day Lochia serosa is 5th to 6th day, and Lochia alba is 10th to 15th day. So Lochia rubra means the red discharge, bloody discharge in this fetal membrane, decidua, shreds, lenigo, and meconium is present. Lochia serosa. This is a blood mixed discharge. In this leukocytes, cervical mucus, wound exudates, and microorganism is present. Then Lochia alba. Lochia alba is white discharge. In this leukocytes, mucus, polystyrene crystal, fatty epithelial cells, and microorganism is present. So if we are seeing if suppose involution of the uterus is not there, suppose size is not decreased, so that is a pathological condition. Even if we are seeing 3 types of lochia is there, in 3 types of lochia foul smelling is there, then again it is pathological condition. So suppose if malodors is there, puerperal sepsis and infection of Escherichia coli may be present. Scanty lochia or absent, again infection and lochiometra may be present. If excessive discharge is there, excessive lochia is there, then we can suspect some infection. Then if red color is persist, then we are thinking about the involution hua hai ki nahi. So there will be chances of sub-involution, or maybe return product of conception, or cause secondary PPH, or maybe return placenta. If lochia alba beyond 3 weeks, so it is maybe due to local genital infection. Then general physiological changes during puerperium. Pulse. What happened? Pulse increased. Tachycardia may be there, but settled down normal on 2nd day. Temperature, mild temperature rise should be there. But if rise more than 0.5 centigrade, suggestive of some infection will be there. Most commonly, GIT system, genitourinary tract infection. Urinary tract, pronounced diuresis on 2nd and 3rd day. Tract is over distension is there, incomplete emptying, presence of residual urine, high risk of infection. In GIT, increased thirst and constipation. Thirst why increase? क्योंकि patient को बहुत work करना पड़ता है, so there is dehydration will be there. Weight loss, of course, weight loss is there due to expulsion of fetus, liquor, membrane, placenta, and fluid loss. Blood value. What happened to blood values? Immediate reduced blood volume and normal in 2 weeks. Rise in cardiac output and become normal in 1 week. Leukocytosis due to stress. Hypercoagulation state for 48 hours. Fibrinolytic activity enhanced in 4 days. Then menstruation. If there is no breastfeeding, no complication, and so it is resumed within 6 to 8 weeks. 1.5 to 2 months, again she will start normal menstruation. What about the ovulation? In non-lactating women, 4 weeks. In lactating mother, 10 weeks. And exclusively breastfeeding, this is a 98% contraception up to 6 months. Lactation. For the first 2 days following delivery, no further anatomical changes in the breast occur. The secretion from the breast called colostrum, which start during pregnancy, become more abundant during the period. Composition of the colostrum. It is a deep yellow serous fluid, alkaline in reaction. It is not a higher specific gravity. It is a high protein, vitamin A, sodium, chloride content, but has got lower carbohydrate, fat, and potassium than the breast milk. So we should encourage patient and we should teach staff immediately after delivery. We have to start breastfeeding. Why? Because due to colostrum, and colostrum is a very good for baby. Microscopically, it contains fat globule, colostrum corpuscles, and acinar epithelial cells. The colostrum corpuscles are large polynuclear leukocytes, oval or round in shape, containing numerous fat globules. Advantage. The antibodies IgA, IgG, IgM, and humoral factors lactoferrin provides immunological defense to the newborn. It has a laxity effect on the baby because of large fat globule. So if we will compare breast milk and colostrum, so colostrum is having 8.6 gram protein, in breast milk only 1.2, fat 2.3, and in breast milk 3.2, carbohydrate more in breast milk, and water lagbhag approximately same. Then what is the physiology of the lactation? The physiology basis of lactation is divided into 4 phases: preparation of breast, mammogenesis, synthesis of and secretion from the breast alveoli, lactogenesis, ejection of milk, galactokinesis, maintenance of lactation, galactopoiesis. So stages is mammogenesis, lactogenesis, galactokinesis, and galactopoiesis. So this diagram I will explain later. In this diagram, lactation reflects arc and the role of prolactin and oxytocin. Mammogenesis, pregnancy is associated with remarkable growth of both ductal and lobulo-alveolar system. And intact nerve supply is not essential for the growth of mammary gland during pregnancy. Lactogenesis, the alveolar cells are the principal site for production of milk. Through some secretory activity is evident during pregnancy and delivery. Milk secretion actually starts from the 3rd or 4th postpartum day. Around this time, the breast becomes engorged, tense, tender, and feel warm. Prolactin, insulin, growth hormone, and glucocorticoids are the important hormones in this stage. The secretory activity is also enhanced directly or indirectly by growth hormone, thyroxine, and insulin. Galactokinesis. Oxytocin is the major galactokinic hormone. Discharge of milk from the mammary gland depends not only the suction exerted by the baby during suckling, but also depend on the contractile mechanism which express the milk from the alveoli into the ducts. During suckling, what happens? Condition during suckling, a conditioned reflex is set up. The descending tackle impulse from the nipple and areola pass via thoracic sensory 4, 5th, and 6th different neural arch to the paraventricular and supraoptic nuclei of the hypothalamus to synthesize and transport oxytocin to the posterior pituitary. Oxytocin is liberated from the posterior pituitary and produce contraction of the myometrial cells of the alveoli. Cut kar dena. Oxytocin is liberated from the posterior pituitary, produce contraction of the myoepithelial cells of the alveoli and the duct containing the milk. This is the milk ejection or let down reflex, where by the milk is poured down into the ampulla of the lactiferous duct, where from it can be expressed by the mother or sucked by the baby. So this is the diagram. In this diagram, see, suckling of the milk. Okay. Suckling of the milk is when it will suckle. Oxytocin is released from the pituitary gland and वो breast पे भी आ रहा है, alveoli पे आ रहा है, then अपना intestine पे work कर रहा है, then uterus पे work करके uterus को contract कर रहा है, and then इसका जो फीडबैक जो अपन ने पढ़ा नेगेटिव फीडबैक, उसमें बेबी ने सकल करा T3, T4, T5 एंड T6 पे, सेंसेशन गया एंड नर्व से, देन हाइपोथैलेमस में स्टिमुलेशन हुआ एंड देन अगेन इट स्टार्टेड सिक्रीशन ऑक्सीटोसिन अगेन। तो ऑक्सीटोसिन से सिक्रीट भी हो रहा है, बेबी ने शक करा, रिफ्लेक्स एक्शन से वापस से और ज्यादा सिक्रीशन हो रहा है। The milk ejection reflex is inhibited by factors such as pain, anxiety, breast engorgement, or adverse psychic condition in depression. The ejection reflex may be deficient for several days following initiation of milk secretion and result in breast engorgement. Galactopoiesis. Protein appears to be the single most important galactopoietic hormone. For maintenance of effective and continuous lactation, frequency of suckling is essential. Milk production. A healthy mother will produce about 500 to 800 ml milk of a day to feed her infant. This requires about 700 kilocalories per day for the mother. So, stimulation of the lactation. Following delivery, important steps are to put the baby to the breastfeed at 2 to 3 hours interval from the first day. Plenty of fluids to drink and avoid breast engorgement. Early and exclusive breastfeeding is correct to encourage. Drug improve milk production. Galactogogus. Metoclopramide 10 mg thrice daily increase milk volume 60 to 100% by increasing prolactin level. Sulpiride, dopamine antagonist, domperidone has also been found effective by increasing prolactin level. Lactation suppression. It may be needed for women who cannot breastfeed for personal or medical reason. Lactation is suppressed when the baby is born dead or die in the neonatal period, or if breastfeeding is contraindicated. Method commonly used are to stop breastfeeding, to avoid pumping or milk expression, to wear breast support, ice pack to prevent engorgement, analgesic to relieve pain, and tight compression bandage is applied for 2 to 3 days. Breast milk for premature infant is beneficial by many ways: psychological support, nutritional, and immunological. Metabolic disturbance like azotemia, hyperaminoacidemia, and metabolic acidosis are less with breast milk compared to formula. Then how to manage normal puerperium? To restore health of mother, rest and early ambulation, emotional support, diet of patient's choice, sleep, immunization, anti-D gamma globulin, maternal infant bonding, and postnatal exercise. Recommended postnatal exercise include brisk walking, swimming, aqua aerobics, yoga, pilates, low impact aerobic workout, lightweight training, and cycling. So this diagram is showing exercise after pregnancy. And to prevent infection, care of bladder and vulva should be taken. Care of episiotomy wound, maintenance of asepsis and proper hygiene, immunization, rubella vaccine, and to take care of breast and promote breastfeeding, to motivate mother for contraception. Then how to treat minor ailments. After pain, if patient is complaining pain, so what to do? Uterine massage we can do, antispasmodic we can do, we can give to the patient, ibuprofen we can give. Then pain at site of perineum. So what to do? Analgesic and sitz bath. Treatment of anemia, supplementary iron therapy we can give. So this chart is showing how to and when the involution of the organ is there. Postnatal care. Postnatal care includes systemic examination of the mother and the baby and appropriate advice given to the mother during postpartum period. The first postnatal examination is done and the advice is given on discharge of the patient from the hospital. The second routine postnatal care is conducted at the end of 6 week postpartum. So what is our aims and objective? To assess the health status of the mother. Medical disorder like diabetes, hypertension, thyroid disorder should be reassessed. To detect and treat the earliest and gynecological condition arising out of obstetric pregnancy. To note the progress of the baby, including the immunization schedule for the infant. To impart family planning guidance. So we have to counsel the patient, we have to guide the patient about, we have to advise about contraception after the delivery. Advice given in general, if the patient is in sound health, she is allowed to do her usual duties. Postpartum exercise may be continued after another 4 to 6 weeks. Then vaccination, MMR, hepatitis B, we have to see to evaluate the progress of the baby periodically and do continue breastfeeding for the 6 months. And we should see baby immunization also. Thank you.